Okay, welcome everybody. This is Dr. Kevin Connors. Today we're going to go over some topical cancer, quote unquote, killers. Some things to do with skin cancers, topical cancers that might be beneficial for you because as we all age, we end up with some skin lesions that many times a dermatologist may want to excise and remove. And there may be another way to deal with it before we want to go that route. So let's talk about them. So mainly we're talking about three main skin cancers. There's others. My cancer is different. African cancer, but so rare we're not going to talk about it. And when you look up skin cancer, you won't even see it. So basal cell carcinoma is the one that's most common, this first one here. And it basically looks, this is pretty much how much it looks like with most people. You see that a lot on people's face and head, can be in other parts of the body, but it's very common as we age. And though this can be a deadly cancer as well, it's probably one of the easier ones to treat topically, and we'll go over that. Squamous cell carcinoma is a little bit harder to distinguish. It looks similar to basal cell, but it tends not to have that shiny appearance to it. Squamous cell can go metastatic and become deadly as well. It's not quite as common as basal cell. Melanoma is not as common again, but it is much more deadly. And this is a real I don't know, we call it blatant example of melanoma in this picture. I have never seen a melanoma look quite as angry as that. I think another picture coming up, it looks more like this than it does look like that other picture where obviously it looks like something's like very ominous. So it's hard to distinguish melanoma from a mole often, and that's why people will often get scared. Usually you can tell the difference because, oh, I have never seen this before. This is new. Then you are concerned that it is a melanoma. Basal cell and squamous look quite a bit different than melanoma. Melanomas are the darker color, so it's pretty easy to tell the difference between those type of tumors. So causes. So we talk about causes of cancer. Usually you're going to see on the television that the cause of skin cancer is the sun. Now, the sun is not the cause of cancer, so let's just clear that up. However, getting burned can cause cancer. So what can cause skin cancer is damage to cells. So if you damage the cells, it's like any other cancer. If I have liver cancer, why did I get liver cancer? Because something got in the cell to damage the cell and to disrupt that DNA replication of the cell. Well, same thing with skin cancer. Something damaged the cell. If you're going out in the sun and getting burned on a regular basis, you do have an increased risk of skin cancer. So do people in Florida and in Southern California and Mexico have an increased risk of skin cancer? Only if they're getting burned on a regular basis. I would say that a person from the north who is not used to being in the sun and goes out in the sun and gets burned has an increased risk of skin cancer, much more than somebody who lives in a southern area and is used to getting sun and is not getting burned. They might have a real healthy tan, but they're not getting burned. So many things you'll see in the news is that you need to wear sunblock because the sun is this awful, evil thing that is causing skin cancer. Well, the chemicals in most of the over-the-counter sunblock are probably bigger cancer killers than the sun is. Now, I don't believe that you should not use sunblock and just go get burned. You have to be careful with that. Personally, I don't ever wear sunblock, but I have the type of skin where I tend not to burn very easy. If I'm careful, I wear a shirt or a hat, and I'll just tan. So I don't worry about getting burned as much as some other people. People with some Norwegian type skin may burn really easy, and using a natural sunblock is what we recommend, something without all those chemicals that is not good for you either. So it's damage to the cell that is really the cause of skin cancer. And the most common damage to the cell is frequent burning. So you can get burns from other reasons too. That's why a person does radiation for breast cancer. Very, very common that they end up with melanoma years later in that spot that they had radiation, because the radiation caused the skin damage, similar to getting burned in the sun. What are some things you can do for it? So we're going to go mildest to strongest here on some of the topical things that you can do for skin cancers. Essential oils is probably the mildest thing. It's the easiest things to do. Essential oils are available just about anywhere these days, and using a drop of tea tree oil or oregano or frankincense or myrrh, and you can try a whole bunch of different kinds. The different types of essential oils that are out there are based upon what they're distilling this off of to get the essential oil. That's hence the name of the essential oil. And they all have a little bit different properties, but it's the terpenes that are in the essential oil that really can be effective for cancer. So there's at least a dozen other ones that are, have a lot of research on cancer that you could use. I just picked 3 here for this topic. But these would typically be used more so on the basal cell, squamous cell type cancers. I have not seen essential oils be successful for melanoma personally, but certainly for basal cell, we've had patients use tea tree oil or oregano oil on their basal cell, and it killed the basal cell and it flaked off and it was gone on numerous occasions. So this is the easiest thing to do because it is clear, it is painless, it is simple to do, to drop on your finger, dab it on that spot on your cheek or wherever that spot is. Nobody knows the difference, and you do that, carry that bottle around in your pocket, do that 3, 4, 5, 6 times a day every time you remember it, and you could have good success with that. I've actually used tea tree oil on a wart that I wasn't sure that if it was a skin cancer or basal cell. I still don't know up to this point. Could have been a basal cell, could have been a squamous cell, but within about a week, it just flaked right off and was gone. And I was dealing with that for probably about 6 months. I was quite sure that it wasn't a melanoma, so I just did the oil, and I think I actually used the Panaway oil. That's another anti-inflammatory oil by Young Living. That's the oil that I used. I just had it at home and I used that. What we typically use for basal cell cancer is our Curcumin cream that I developed. It is a shea butter cream with curcumin in it, and we use a little bit of blood work, very small amount of black salve in it as well, but it's just a teeny little bit that you really wouldn't get a black salve reaction for it. It's just the blood root of the black salve that we put in it. And it's mainly curcumin. The negative, we've had really, really good success with this with basal cell and some squamous cell cancers. The negative is that curcumin is that yellow color, and because of the yellow color, it stains. So you'll get a yellow spot. If it's on your face, it's not, you got that yellow spot on your face. And if you're putting it on at night and then you're going to bed, it can stain your pillows. So it's going to stain your pillowcase, it's going to stain your sheets, it's going to stain anything that it gets in contact with. So that's the negative of any topical curcumin cream. The benefit is it's worked on just about every patient that we've used it on for basal cell for sure. So it's been a nice, good topical cream. It's also a great cream for arthritis and things like that. So we use it for a few other things, but that's our curcumin cream that we use. This is only available to our patients because it's not labeled for sale. Next thing is Curaderm. That's a product that you can buy over the counter, and it it's a product that I don't have any testimonies on because I've never used it and I haven't had any patients use it. But I do know some other doctor friends of mine have used it with their patients and have used it quite well. And again, it's something that you would use typically for the basal cell and squamous cell. I have not heard any reports of it be helping with melanoma. But this is a product that you could buy even on Amazon. It's I forgot what it's made of, but it's got some really good curative properties in there for skin issues. And it can be for, you could use any of these that we've already mentioned. You could use on moles, you could use on warts. Um, there's benefits to any use of any of these products on skin and such as well. You could do the same thing with this next one. This is the CBD oil and cream. This is from Canaway, the K-Sav. We sell the most of this. The Evolve just came out with a new one that we haven't, we're just starting to carry right now, called their Is product. Um, uh, Using a CBD cream or oil can be beneficial for any skin issues. I don't have a lot of testimonials for topical cancers for this, but we've had patients do it where they've done this over their breast cancer, over a cancer area that wasn't a skin cancer, with some good success stories of that as well. But certainly using a CBD cream over a cancer would be something to consider for sure. It really has no side effects, no drawbacks. It's clear. It's similar to using essential oil in the fact that it's not going to stain anything, so you don't have those secondary issues. Other things are using a poultice. And I just put a picture of one of our videos. Michelle and I did a member minute on poultices. You can search that in our video archive. That is something we've done on numerous patients, is doing poultices. And this isn't just over skin cancers. This is over for anything on the skin or over the liver or over the breast. But poultices tend to draw things out, and that can be beneficial as well. Under the other category, I also put THC, which would be Rick Simpson's oil. Now, that may or may not be legal in your state, so we won't talk a lot about that. But that is something to consider as well. Rick Simpson oil is high THC, so that's the opposite component of the CBD that's found in marijuana. And the THC can have excellent curing effects, and that would be something that would be possible to even use over a melanoma as well. And then the last one that we talk about is black salve. Michelle and I did a members minute on black salve itself, giving you the pros and cons of black salve. The biggest con of black salve is you do not want to do this on your own and without the following some doctors' help and getting that hand-holding going through it, because it can be horribly painful as it draws out the cancer. But we've seen this firsthand with, I don't know, maybe a dozen melanoma patients, my wife being one of them. She had 2 spots of melanoma drawn out with the black salve. Took about 30 days for each spot to come out. Extremely painful, needed to get some pain meds for it. And but it killed the melanoma. That was 6 years ago now. So she's got a clean bill of health as far as that goes. So that's very good news. And the first person we actually ever did this on was, 10 years ago. And I was looking up, I had pictures because it took 7 days for his to come out. I had pictures of it on my old computer, but I couldn't take them out to show on the slide presentation, but it's pretty cool. But black salve can be a ginormous lifesaver. Again, I'm not a fan of getting cut on when you have skin cancer, because it can tend to spread the circulating tumor cells everywhere through the body. So I'm not a big fan of that. So if you can do things topically, I think you're much better off doing it topically, or at least attempting it topically prior to doing any surgical intervention. Now, the problem is that you go, well, how do I know if it's cancer or not? What if this is just a mole and I'm going to put CBD oil on it, or I'm going to put essential oils on it? Well, there's nothing wrong with doing that. You're not going to hurt yourself putting curcumin cream on something that looks like a squamous cell, but it's just a mole, or it's just an injury, or you got bit by a spider and you didn't even know it. So using, products like essential oils or curcumin cream or Curaderm or the salve is not going to be harmful for you. So there's no harm, no foul in trying these things before you go and do a surgical intervention. So somebody asked a question: Is the CBD oil clear? Yes, it's like a Vaseline kind of looking substance, but it's fairly clear. But it's more of a salve, so it's not runny, which is kind of nice. So it will stay in place a little bit easier. And we had patients put like a Band-Aid over that spot, so they're not wiping it off, and it makes it easier. But if you're doing essential oils, you don't necessarily want to put a Band-Aid on it because you want to keep dabbing it throughout the day. And that's the better way to do it. Again, you certainly would not do black salve unless you had somebody supporting you and you were dealing with a practitioner, or we were instructing you to do that. We do not sell black salve in our store for that reason. We do not want any non-patients buying black salve and trying it themselves, because it can have some scary side effects. But you could search easily on Google and find wonderful stories of people who use black salve. Here's a story of Bill O'Leary. If you just search, I just quickly searched black salve stories. His story came up on how he was successfully treated a melanoma on his nose with black salve. It doesn't show you the between here. I'm sure he went through a month or 2 or 6 of healing for his nose to be perfectly healed over like that. But it's certainly a lot better than the alternative, because the alternative on a cancer like this, if you go in and they find out it's melanoma, they're literally going to maybe do a biopsy of it here, take a little piece of that melanoma. I don't know if you can see my cursor. But then if it comes back positive, then they're going to do what's called Mohs surgery, which is they're going to excise everything that they can see visually, and then they're going to send it to the lab right there while they have you still on the table. See if the quote-unquote margins are clean, and if the margins are not clean, they're going to go deeper and deeper and deeper. Well, for instance, on my wife's melanoma, it was a size smaller than a dime when we put the black salve on there, and it opened it up to about the size of a hard-boiled egg. So literally, I believe if we went in for the surgery, she probably would have had her clavicle removed and had very little function of her right arm at this point in time. So it was much better going the route that we did. And her recovery was so much nicer. So, but you can see stories like this online. You can go on YouTube and get some stories as well. Now you'll hear the medical reports from the medical community and those that they've hired to try to destroy this type of treatment say all sorts of negative things about black salve and how it's wounded people and scarred people. But it's you look at what happens to a person doing a surgical intervention of a cancer like this, and don't get me started. So if a person does surgery and removes the melanoma, that's fine. You already did it. You certainly want to treat it systemically, even if you did the surgery. If you haven't done the surgery yet, I'd suggest you find a practitioner that will help you do a topical attempt to a solution before you do the surgery. That's just my opinion, and I'm sticking to it. So. All right, so somebody asked, do you have a preferred topical treatment for basal cell carcinoma? Yes, again, for basal cell, I would start with essential oils. If that doesn't make it really go away within about 2 months, if you're dabbing it on every day, then I would go to the curcumin cream. The curcumin cream, again, the only negative of the curcumin cream is that it stains. So as long as you can, it's in a spot where you can put a Band-Aid over it so it's not staining your pillowcases, or buy some cheap pillowcases or something like that so you don't worry about it staining. And you can keep the curcumin cream on. This has worked I think just about every time we've used it for basal cell at this point in time. So that's been very encouraging. It's just that negative of the staining. Okay, so we are going to unmute everybody, and my voice is not that great because I have a cold. I apologize. So, but I'll stick around for a couple questions here.
Yes, Dr. Connors, this is Cher.
Hello, young lady.
Hi. You know, I have the little string of tumors like on the back of my neck or shoulder, whatever. Would one of the creams be beneficial to me? I do the frankincense, but I didn't know if like the Curamed whatever.
So the Curaderm is
Sure.
meant for just topical.
Mhm.
So you don't have, it's not a topical cancer. It's not a skin cancer. Now, even
Right,
these skin cancers like this, they still have, you know, multi-cell epidermal lining over the top of them. So
right,
like typically when you put black salve on a melanoma, it's not like you put the black salve on there and it starts eating away right away, and you know, it increases your pain. You know it's working. Typically, you
right,
don't know it's working for sometimes a couple days,
right.
because it's got to eat through the first couple layers of skin.
Mm-hmm.
Now, that's one way that you'll see online. How can I tell it looks like this? It looks just like this. Is this a melanoma or is it a mole? Well, you'll see online, well, put some black salve on there and you will know. Well, I wouldn't necessarily recommend that. But
Right.
if you did put black salve on there, like I had a mole when my wife was doing her melanoma, I thought, oh, well, I have this mole. I'm going to put black salve on it. Well, a week later, it didn't do anything. It didn't hurt, nothing. Black salve,
Mm-hmm.
I scraped it off and it didn't do anything because it was just a mole.
Right.
Now, there are reports of a black salve helping a mole too, but usually it's going to be a melanoma that's going to eat away. Now, if you have a deeper cancer, so you have a cancer that's deeper than the layers of epidermal tissue, layers of your skin, so it's underneath,
Right.
deeper layer underneath your fat layer, that is right subdermal. There's no way any of these are going to get to it.
Okay.
You can consider, and we have done that with the curcumin cream. We've added DMSO to it.
Mm-hmm.
So DMSO is a driver, and then you're adding a driver to it so that when you put it on, it's going to drive it, you know, help suck some of the curcumin through the skin and through the fat layer to the.
Uh-huh.
That's one way to get it through. You could do that same thing with essential oils. You could use a DMSO as the as the
Carrier.
carrier oil. Yeah, even though DMSO is like water, um, you can still use it as the carrier.
Hmm.
So you can dab on some DMSO to, you know, it's like water, but you're basically putting it on over a 3-inch round area, let's say on the back of your neck, and then
Mm-hmm.
putting, you know, 5 drops or 2 drops of frankincense and smearing it in. You won't get the burning of the frankincense because you have another liquid there. Um,
Mm-hmm.
and then the DMSO will help draw it in.
Mm-hmm. What is
So
DMSO? What is that?
DMSO is dimethyl sulfoxide, which is, it can be used as an anti-inflammatory in itself.
Mm-hmm.
Um, that's what some people will use DMSO. I have a bad knee, they'll put a little DMSO on their knee. Um, but we typically use it as a driver.
Mm-hmm.
Because DMSO just like draws right through the skin.
Mm-hmm. Well, my skin is very thin and very smooth where those are.
Yeah, so that'll make it easier too.
Yeah, I mean, like there's no fat. There's
Right.
it's
But you
just there.
do have a subcutaneous fat layer.
It must
So
be hiding, but
yeah. But I
yeah.
would put, you know, that would be one thing to do. You can buy, we don't have just DMSO, but you can buy it on Amazon.
Okay.
And it comes in like an 8-ounce bottle, and you probably won't go through all that
Okay.
because you can just
DMSO. Okay.
DMSO, and you can dab it on. It's just like water. You can
Okay.
dab it on a cotton ball and then put it on the skin, and then put a couple drops of the oil on it, and then that's
Okay.
one way to get it in. If you use too much DMSO, you will have the taste of garlic in your mouth.
Mm. I seem to get that anyway. So something am taking is causing that. And I'm not sure what's causing that.
Well, the only thing that would cause that would be a sulfur compound, like eating garlic or eating onions.
Yeah, but it hasn't been so much that. I don't know. I do that curcumin or curcur something or another. I
Well,
mean, I don't know.
curcumin wouldn't do it.
No, I don't know.
Huh.
It's weird.
You're not taking MSM, are you?
What is MSM?
MSM is I forgot. It's an anti-inflammatory that a lot of people take.
I don't think
So
so.
you'd know it if you were taking it.
Yeah, no. So I don't
And
know.
certainly you could do a CBD oil over the top of it too.
Mm-hmm. Now, will like by doing the DMSO and the frankincense, will that try to kill it, or will it try to draw it out?
Well,
Or
DMSO is an anti-inflammatory, so that could help decrease the inflammation right there.
okay,
But I would put something with it that could be a cancer killer, like frankincense.
yeah,
So
yeah,
that you're pulling the frankincense, you're getting a double whammy there.
yeah. Can I do that with the one of my armpit too?
Yeah.
Okay,
Yep.
all right, I'll order that. And um, I have a little bit of a different frankincense after I'm almost through with my Young Living one. I have one from another company that I'm like, well, let's just use that up.
Yeah.
And
Sure.
and
Absolutely.
then okay, DMSO.
Yes.
Okay, I'll order that. Okay, thank you.
Okay, question came in. I had a noticeable increase in skin moles right before I was diagnosed with prostate cancer. Is there any relationship between the two? Probably not. I don't know. Maybe if you search the research, you could find some correlation. I can't think of one off the top of my head from a physiological standpoint that would make any sense to me right now. Um, uh, you know, maybe if your body was, immune system was fighting the prostate cancer and that was starting to grow and get out of hand because obviously you had it before the diagnosis, then it the cells on your face, but those were skin moles, you said. So yeah, I can't imagine any correlation, no. All right. Well, remember, if you have questions, this question here came from somebody who emailed it in. So email those questions in, and we'll get them answered the best we can. And we'll get this up on our Facebook page. Thanks so much, you guys.
Thank you.
All right. Bye-bye.
Bye.